Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thank you for joining me again this week. Today, I am here with Dr. Jennifer Tirino with Northside Otology. Did I get that right, Dr.
You got it. That's
Tirino?
right.
And I got a lesson in what otology is right before the show. Honestly, I didn't even know that there were otology specialties. I thought, we're here today. Why don't I let you tell the folks? Welcome to the show, first of all.
Thank you very much. It's a pleasure to be here.
So I guess the very first question would be, what is otology?
So otology is a subspecialty of ear, nose, and throat, or ENT, where a doctor specializes just in treating the ear and disorders of the ear.
Okay, because you always think ENT, if something's wrong with your ears, your nose, your throat, but you're a subspecialty of that ENT physician.
That's right.
ENT office.
That's right. So after medical school and residency and learning how to be an ENT doctor, I spent a couple extra years in a fellowship learning how to take care of just ear problems and the intricate details of the ear and some more complicated issues than a general ENT might want to take care of.
So I'm just curious, just from my own curiosity, and this is Dr. Tirino's first time on the radio, and I said it's more like just girl hour because I get curious and I just want to ask questions. So here's the first thing that's going to show you that this is really just let's talk to Jeannie Pete and help her curiosity. But so how does one decide I'm going to work on ears for a living?
I am so privileged to do what I do and to find this little subspecialty. I get to make people better every day. And I can see a problem and fix the problem, and then somebody leaves my office really happy. It is just the best profession in the world. As you go through medical school, one of the things that you do is you do a little bit of this and a little bit of that, and you kind of learn about the different areas of the body, and you learn about yourself. What do I like to do? Do I like to fix problems? Do I like to have long-term relationships with patients and get to know them over 30 or 40 years? Do I like to deal with adults or with children? And the very first thing I did in medical school was ENT. And the very first person I met was a really wonderful otologist. And I have to say that probably pushed me a little bit in this direction. But then I tried everything else and came back to it.
Isn't that funny? I wonder what the statistics are on that regarding what is the first specialty that interns, try out, and is that where they go? I'd be curious. I wonder. I don't know the numbers. I do know that at the very beginning of medical school, they give you this little personality profile test, and you take this test, and it tells you what you're good at. And I said, oh, well, that's very nice. And I put it away in a file cabinet, and I didn't really look at it or think about it. And as I was packing from medical school to go to residency, where I decided to do ENT, I pulled it out, and I said, well, you are most like people who do well in surgical subspecialties, which is exactly what I'm in. Okay, so it's not all kind of throw a ball in the air and see where you land. There's some strategic placement going on there.
I think there really is.
And who knew they were right? Okay, so what is the average age of your clientele? Does it span? Because when you hear ears, I think of my two boys. Both of them they were having severe chronic ear infections from infancy to about age 1, so I had to have tubes put in for both boys.
Well, I like to say that I see anybody who has ears. So my youngest patients are the little babies that don't pass their newborn hearing screen in the hospital, and I'm seeing them when they're 2 or 3 days old. Wow. And my oldest patients are in their 80s and 90s and are coming to me with hearing loss, maybe hearing loss that needs to have a cochlear implant or some other surgical means of restoring hearing. So it runs the gamut.
Let's talk about that, because I'm curious, at age 80, age 90, you're talking about surgery and cochlear implants. What kind of a surgery is that? How invasive? What are the risks?
Right. So that's a good question. I like to say that nobody ever has to go without their hearing. There is something for everyone. And it's not the same one thing for anybody at any particular age. It's sort of a process that we go through. A cochlear implant is a surgically implanted device. It looks a little bit like a pacemaker, but it goes behind the ear, and it restores loudness and clearness to people who have very bad hearing. The surgery itself is kind of small. Outpatient surgery, you come in, you go home the same day, done with a little incision behind the ear, takes about 2 hours. So as long as someone's healthy enough to undergo a procedure with an anesthesia, then a cochlear implant is a possibility.
Is it a local?
It is not a local.
Really,
it's not a local anesthesia, right?
Yeah.
It does take a general anesthesia. It's done with an anesthesiologist, and so that's part of the whole process. If someone comes in to see me with a hearing loss, okay, how bad is the hearing? What is the right thing for you? Is it a device like a hearing aid? Is it something that is more involved, like a cochlear implant? And then, are you healthy enough to go through that procedure?
Let's talk about hearing aids too. Because the first thing I think about is my grandmother, who lived till she was about 94, and she would get louder and louder in her speech and understand less and less of. We always used to laugh at the elevator conversations when we were with Nana, because we'd say something and she'd answer something completely different. And she was sharp as a tack, but she couldn't hear us. So have we come a long way with hearing aids?
Hearing aids have come a long way. Over the last 5 or 10 years, the innovations in hearing aids have been amazing. But a hearing aid just makes things louder. So when someone has a problem with their hearing, sometimes they lose loudness and sometimes they lose clearness. The hearing aids make things louder, and that's the only thing they can do. So a hearing aid that's fit by an audiologist who really knows what they're doing, who gets you the right hearing aid, the right product, the right loudness, and works with you to get it as good as it possibly can be, can do a tremendous amount for someone who has a hearing problem. But it is a process. It's a little trial and error and working on it and back and forth. So if someone needs a hearing aid, especially their first hearing aid, I tell them to go see an audiologist. An audiologist has an advanced degree, and they'll have initials CCC or AUD after their name. And I tell them to pick a place that sells more than one brand and to pick a place that's close to home where they can go back and forth and really get the product that they need. By federal law, an audiologist has to give you a trial period of using those hearing aids before you're committed to buying them.
Oh, that's
so
great.
It really is a process that you go through.
So what is the average age of someone coming to see you or an audiologist or an ENT before they even get to you? What is the average age you guys notice hearing loss in our population?
Right. So in the inner ear, you're born with a number of nerve endings called hair cells, and you're born with all the hair cells that you will ever have. And slowly over time, over your life, the number of hair cells decreases. When the number of hair cells or nerve endings gets to about half is when most people will start to notice a hearing loss. And how quickly that happens depends on a number of things. If you listen to a lot of loud music or you're exposed to loud noise, those hair cells will go away quicker. If you have a lot of medical problems, diabetes, for example, those hair cells will go away quicker. And if you're exposed to toxic agents like chemotherapy or certain antibiotics, those hair cells will go away quicker. And then the one thing that we can't control is genetics. Everyone has sort of a predetermined rate at which those hair cells will go down. So if hearing loss runs in your family, you may be more predisposed to develop hearing loss at an early age. For most people, they don't need to come in and get a routine hearing test. That's not the usual way it's done. Most of the time I say, if you are doing well with what you need to do in life, you're fine. And if you are not doing well, or if other people are complaining that you're not doing well, come in, get it checked out.
And it's not something where a lot of what I have found doing this radio show is the earlier you catch it, the better, the more we can do. But this is really something, it's more when it's debilitating, we can help you, but there's nothing we can do to reverse it, right? So,
well, to a certain extent. I mean, there are some forms of hearing loss that are correctable. There are some forms of hearing loss that are caused by a little stiffness in the tiny bones of hearing underneath of the ear, and with a minor procedure, that hearing can be restored. So without doing a hearing test, we can't really say there's something that can be done or there's nothing that can be done. So the first step, if you have a problem with your hearing or other people are complaining about your hearing, come in and find out what kind of hearing loss it is. But in the big picture, what you said about, in general, this age-related hearing loss, that you don't lose anything by waiting, that's kind of true to an extent. But at some point, the lack of hearing makes the brain lose the ability to hear. so that the brain sort of forgets how to listen. So if someone goes a very, very long time without having enough hearing, the brain end of things can decline.
And I'm guessing there's a lot of denial in the realization that you're losing your hearing.
A lot of what I do is counseling. The hearing loss for many people comes on very slowly, and they adapt. And they learn how to turn the TV a little louder, and they avoid noisy restaurants, and they start to avoid those big family gatherings. And, you know, the people who love them and are close to them learn how to talk to them. And so because it's so very slow and people adapt, they don't necessarily know how bad they are or how good they could be.
Mm-hmm. I remember we were talking first thing in the show, both of my sons had tubes put in their ears, and you have to go in with a baby to get a hearing test. And so I was in there with my husband, and he couldn't hear. And he said, you know what, I think I need to get my ears checked. And we were in our 30s. But typically, it's what, in your 60s, I would guess?
It differs for everybody. We start to see the first little age-related hearing loss, usually in the 50s, and it's usually just for a couple of high-pitched tones that don't significantly interfere with your ability to communicate. But when I look at a hearing test from someone who's 50, I can tell the difference between that and somebody who's 20.
And what about the age of the cell phone? Is that affecting the hearing? And you hear, too, about tumors coming. Let's talk all about that.
So the amount of noise that a cell phone can produce usually is not enough to damage the hearing. Okay. So using a cell phone, typically we don't worry about that too much. Long-term use of iPods or other devices where you have little things that go into your ear, that can be an issue. You remember back in the days of the Walkman? Do you remember that?
Walkman.
The Sony Walkman,
mine was
right?
yellow.
The great thing about that from an ear doctor standpoint was that the batteries ran out. So you could listen for a couple of hours and then the batteries ran out. But with the new technology, kids can have earbuds in their ears listening to music for hours and hours and hours. And I really like these. You can go to many, many different stores and buy little earplugs that limit the volume, the earbuds that limit the volume that these things can produce. And that's what I have for my kids. That there are some called Loud Enough, and there are some other ones that you put them in your ear and they can only get but so loud.
I'm going to get that because it's true. These kids these days, I mean, my son goes to sleep with those things in his ears sometimes, and he goes to sleep later than me. So I can't always say, take those things out of your ears. That's great. So you can get those at any store?
You can get those at many stores, and they just limit the amount of volume that comes out of your devices. And if you're going to listen to it, it's absolutely fine to listen to music. It's absolutely fine to use earbuds. But what I recommend is that you set it at a comfortable loudness when you're in a quiet place. And then if you go someplace louder, you go to the gym, you go on the train, don't turn them up, because then you're adding loudness to loudness. And that's where the damage can come in.
Huh. Yeah. I want to get to your subspecialty because you are the specialist for surgical intervention when things are really awry. And that's important. So I want to talk about the different procedures that you do to help the ears and hearing. But I'm just fascinated by even my own ears. I'm in my 40s, and I don't like the loud restaurants. And I noticed that the cell phone is always up to my ear. And now I notice if I put it to the right ear, I can hear better. So, but what you're saying is that really shouldn't affect your hearing. But the only thing I can think of for the reason the left ear not to hear as well is because I've always got the phone up to the ear. I don't know.
Well, you bring up a wonderful point. There are some parts of hearing loss that we come to accept, and you tell your doctor about it. It doesn't raise any alerts. But there are other types of hearing loss where you say, boy, you got to get in and get that checked out. And one of those things is hearing loss that comes on all of a sudden. That's absolutely an emergency. There are things that can be done very early on that if you do these things within a couple of days, the hearing can be recovered. And if you wait a month or two, it's too late. One of the other things that sends off an alarm, you've got to come in and get things checked out, is if you have hearing loss that's different in one ear than the other.
Oh, great.
So come on
and why
in.
is that?
Both of your ears have probably heard about the same amount of sounds, and both of your ears are the same age, and both of your ears have the same genetics. So if hearing in one ear is different than the other, it needs an exam. Let's find out what's going on. Is there an infection in the ear? Is there, very rare, but is there a growth in there? Is there a reason why the hearing is worse on one side than the other? Maybe it's just a big ball of earwax that you have on one side and not the other, and it could be fixed, as quick as anything.
Yeah. You hear about people going, we all go get our eyes checked and see where we're at. Because when we age, our eyes go. So it seems logical now that you're sitting in front of me that we should all go and get hearing tests after a certain age periodically. What is your thought on that? Or what is the standard in your industry?
Right. There are certain recommendations about getting your hearing tested. Certainly if you notice any problems with your hearing, you get it tested. Other than that, during a normal annual exam with your internal medicine doctor, whoever you see on a once-a-year basis, they check your hearing, usually by doing something, not too complicated, like putting a tuning fork up to the ear or rubbing fingers in front of the ear. And if they pick up on a problem at that visit, they refer to an ENT or to an otologist.
And do they catch it? Usually?
They do. They're really good.
Okay.
I have so much respect for the people out there on the front lines of screening absolutely everything, and it usually is enough that if you can hear a little finger rub up in front of your ears, pretty good chance that you're hearing almost everything.
Okay. Well, I can hear the finger rub, so I think I'm okay. All right. So let's talk about some of the more prevalent procedures that you perform on the ears and what you do as a subspecialty of the ENT doctor that we all know a little bit better than an otologist.
Otologist. And you're saying it right. The whole name of the subspecialty is otology, neurotology, and skull-based surgery. Okay. And that means I'm a medical doctor and a surgeon for any disorders of the ear. The biggest, most complicated surgery that I do is for a benign growth on the nerve of hearing and balance called acoustic neuroma. An acoustic neuroma is a slow-growing benign tumor that starts on the nerve between the ear and the brain, and it grows into both structures. So when I do the operations for that kind of tumor, I work together with a neurosurgeon, and it's a long procedure where someone stays in the hospital for several days. The smallest thing that I do is take care of little holes in the eardrum. So someone has an ear infection and the eardrum ruptures, or, heaven forbid, they put a Q-tip in the ear and the eardrum ruptures, they come in and we get a hearing test and I see the hole, and then do a small outpatient procedure where they come in, go home the same day and close the hole in the eardrum, and kind of everything in between.
Let's talk about the, I'm trying to get back to the word you used,
acoustic neuroma?
Acoustic neuroma.
Right.
What causes that?
Acoustic neuromas, for most people, are sporadic, meaning we don't know. It doesn't run in families, and it just is sort of bad luck that it happens.
But it's pretty prevalent. You do it a lot?
Well, because of what I do, the people who have these type of things find me.
I see.
There are not too many otologists, neurotologists, skull-based surgeons in the country, and because of that, the people who have this pretty rare tumor concentrate on coming to the doctors who can take care of those type of tumors. There is a form of acoustic neuroma where you'll have it, where patients will have it on both sides, and that comes from a genetic condition called neurofibromatosis. But that is pretty rare. So, what are some of the symptoms? Hearing loss in one ear.
Yeah, great. Okay, I interviewed a foot and ankle doctor a month ago, and after the foot and ankle interview, I went and saw him, and I've got something going on there. I interviewed a skin cancer physician, went and saw him, and that's why this lovely scar is here. But the good news is I'm so privileged to meet all of you, because so far the radio show has saved me from future worse conditions than if I didn't pay attention. Oh, Lord, folks. Okay, so if you have hearing loss in one ear, go and get it checked. Again, we say this every single time I have a physician on the radio. Let's not live in denial. Let's not worry. We are our own best advocates for our health. So I will be seeing Dr. Tirino. After the show, we'll make an appointment.
Wonderful. Happy to see you.
Okay, so that's predominantly the biggest symptom. One ear, you just hear less.
That's right.
And what's a typical age of someone who has that?
It can occur at any age from the 20s until, 60, 70, 80.
Okay, and we're not sure what causes it.
No, there have been a couple of research studies that show that the number of acoustic neuromas is increasing. The prevalence is increasing. And there are a few theories about why it might be the case. Does it have anything to do with cell phones? But
that's exactly what I'm thinking as she's talking, because it's the ear. I always have my cell phone up.
Right. But, I think that the reason why we're finding more acoustic neuromas is just that the imaging technology that we have is so much better. Mm-hmm. Over the last 20 or 30 years, with the advent of high-resolution CAT scans and MRI scans, we're finding tumors smaller and earlier than we would have found them, 30 years ago.
And that's good. Thank goodness for that. What happens if you let that go? It just the hearing gets worse, or does it get painful, or does it affect the brain, or?
Right. So the reason that we treat acoustic neuromas is that as they get bigger, they push on surrounding structures. First, they arise on the nerve of hearing and balance, and the next thing they push on is the nerve that moves your face. And then they can start to push up against the brainstem, and the brainstem does critically important things that we need, like walking and breathing. So if there's an acoustic neuroma, it's important to get it treated before it leads to other problems. In and of itself, it doesn't spread. It doesn't metastasize to other areas of the body, but just because of the bulk of it, it can push on things.
And you can just go in, get it taken care of, and be cured of it.
Well, there are several different ways to treat acoustic neuromas because they grow extremely slowly and they're benign. A lot of times I'll watch them with an MRI scan once a year for a couple of years. And if it shows that it's getting a little bit bigger or starting to get into the location where it could cause some trouble, then it can be treated with a one-day dose of radiation called a gamma knife or something similar to that, or it could be surgically removed. And which one you do kind of depends on how big it is and where it is and how old you are and some other factors.
Okay. We never seem to have enough time. I would like for you to get your contact information out before we go any further here. But you're at Northside Otology in Atlanta?
I have two offices. One is in Roswell and one is in Cumming. My Roswell office is at 1360 Upper Hembry Road, Suite 101. And my number there is 770-225-1874. You can find me by Googling, ear doctor. I have a website, atlantaearsurgeon.com. You can see me there.
atlantaearsurgeon.com?
That's correct.
And I'm sure there's lots of information on that website if anyone is having trouble with their hearing.
That's right.
Okay, great. So again, we're talking to Dr. Jennifer Tirino. If you or anyone you know is hard of hearing, you're noticing hearing loss in hearing loss, not hair loss, hearing loss in one ear, and you live in the Atlanta area, please contact Dr. Tirino at 770-225-1874. But no matter where you live, because we also air in the Gulf Coast, New Orleans, Phoenix, Arizona area, start with her website at atlantaearsurgeon.com, and I'm sure there'll be wonderful information. And also, do you have referral information about how they can find a doctor near them if they're not here in the greater Atlanta area?
I don't have that information on my website, but the American Academy of Otolaryngology has a great list of doctors near you.
American Academy of Otolaryngology.
You got it.
Did I get that right?
Right.
Okay. Well, folks, we have to take a quick break, but stay with me because we haven't even gotten to the bottom of half of the procedures that Dr. Tirino does for people to help them regain their hearing. We'll be right back. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. I'm Jean Pete. Thanks for staying with us. I'm still here with Dr. Jennifer Tirino with Northside Otology, right here in the greater Atlanta area. She's got an office in Roswell, Georgia and Cumming, Georgia, and she can be reached at 770-225-1874, or you can check her out on her website at atlantaearsurgeon.com. Before the break, we talked more big picture about hearing loss in general, some of the symptoms, how it can be affected if you don't take care of, if you don't get checked. We did talk a little bit about cochlear implants, but now that we're back, I want to dig more into some of the procedures that Dr. Tirino does to help people who have had hearing loss regain their hearing. We talked a little bit about cochlear implants, and I know on my Facebook page, we're starting to see those beautiful videos of these babies who get the cochlear implants, or children, and hear their parents' voices for the first time. And it always makes me tear up. And so that's a wonderful procedure. But what other surgical devices do you treat folks with or implant to help them with their hearing? And in what instances would you use those?
One of the latest things that have come a long way over the past 10 years or so are implantable devices called bone-anchored hearing aids. And bone-anchored hearing aids are for people who can't wear a traditional hearing aid, either because their ears are not healthy enough, they have chronic infections or draining ears, or even don't have an ear canal at all, or people who have complete hearing loss on one side with relatively normal hearing on the other side. Those folks were not able to have a hearing device that worked well until the advent of this newer technology. So a bone-anchored hearing aid, there are 3 different brands, and they have some different pluses and minuses to those, but basically it transfers the sound directly from the outside world through the skull bone and into the inner ear, without having to go through the ear canal. So if, for example, somebody had chronic ear infections with a hole in the eardrum and the ear may be drained, so that they didn't hear well, but they also couldn't put a hearing aid in there on top of, an ear with a chronic ear infection. A device could be put behind the ear, and with a small outpatient surgical procedure, a little device is placed in the bone behind the ear. And some of those will have a magnet that stays under the skin, and some of those will have a small post that sticks through the skin. It looks like the titanium post that's used for dental implants. And a hearing aid will clip onto that. Huh. The hearing aid then picks up sounds from the outside world and sends it directly into the skull bone, and it can travel into the same ear or the ear on the other side.
Oh, wow, that's cool. Now, let me ask you this, because we were talking about hearing aids and how they're great and they help people hear when it's just volume oriented, not clarity. Is there a difference in this type of hearing aid? If you're putting it right into the bone, does that also help with clarity then, or no?
Right. So hearing aids of any type, the bone-anchored hearing aid or the more traditional hearing aid that we're used to see, they make things louder, but they don't make things clearer.
Okay.
If there is a loss of clearness, and a significant loss of clearness, a cochlear implant can restore loudness and clearness. And there's this exciting new kind of cochlear implant for people who still have quite a bit of residual hearing, but they have decreased clearness. So a cochlear implant makes things louder and clearer, whereas a hearing aid of any type makes things louder.
And is it more prevalent that people just need the volume turned up, or are you seeing that the clearness is becoming a more prevalent issue?
More often than not, volume is what is needed.
Okay.
That is extremely common for people to need some volume.
Okay.
Yes.
But clarity is not usually
That's
an
right.
issue. Okay. Because again, and I'm so sorry to always talk about Jeannie Pete, but I'm an expert in me more than anything else. When you're talking on a cell phone, it doesn't seem like it's as clear. And sometimes you can hear people and they're too loud, but the clearness isn't quite there. Is that typical because of the cell phone, or is that something where you should, go get your hearing checked?
Well, if you can hear people when they're face to face and you can hear natural sounds, you're okay. There are a lot of things that go into cell phone technology. It could be the case on your cell phone. It could be how the cell phone company compresses the signal and then turns it back into speech.
Okay.
The quality of sound that comes out of a cell phone is not as good as the quality of sound that is face to face.
Okay, so if you're hearing fine during the day, any typical interactions, that's pretty good indication that everything is going all right.
Right. And, you know,
she's
maybe
looking at me. She's kind of laughing because she knows what I'm doing.
Right. Well, you know, you may want to grab somebody else's cell phone and see if it sounds as bad
true.
as yours. You may just need a new phone.
I just worry in the cell phone age. I really do. I find myself putting it on speaker as much as I possibly can because I'm afraid to have a cell phone up to my ear with all of the rumors about these tumors developing because of cell phones, and we don't really know.
I think getting any radiation source away from your body that you possibly can makes a lot of sense. And some people do hear much better on speaker too, because when the phone is on speaker, you're engaging both ears. And that's a more natural way.
Yeah. And how do you feel as a specialist in the ear about these Bluetooth devices?
A Bluetooth device will actually get a lot of that radiation away from your head, and I think it's a wonderful idea.
Okay,
to use a Bluetooth or a hands-free device.
Because I was worried about sticking something in my ear to hear. I wondered if that was dangerous too, but no, it's basically getting the radiation away.
I think that's a good idea.
Okay, great. All right, so let's talk about, this is really going to test me here. During the break, Dr. Tirino asked me to talk about cholesteatoma.
Cholesteatoma.
I did good.
There you go.
What is it?
So cholesteatoma is one of the more common things I treat. It is a benign cyst that occurs inside of the ear, usually in response to prior ear tubes or prior ear infections or an eardrum perforation. The cholesteatoma, while it's benign, it can be quite destructive because it sort of melts away everything that it touches, including the delicate little bones of hearing that are underneath of the eardrum. So if someone has a history of ear infections, maybe when they were young they had ear tubes, and then as they got older their hearing was okay for a while, and then their ear started to kind of drain or smell, or the hearing went down in one ear, a lot of times that can be due to this process going on in the ear. And it's easily treatable, easily surgically treatable. With removal of it, and it's important that you take care of this.
You know, it brings a question to mind because both my boys had tubes put in their ears when they were younger, and supposedly they come out on their own, and you have them tested year after year, and it's a decision for a parent. Should I have the tubes put in or not? I didn't quite have the greatest decision the first time around because we had so many antibiotics that my first son got contracted C. diff. So we said, we've got to do this.
Right.
But I really had a struggle with the decision for my second son. And it was great. They haven't had a lot of ear infections. They're now teenagers. But my first son does have a hole in his ear. And he did get sick last year. And he said, Mom, I felt this awful pain. And I don't feel like I can hear out of my ear. And I did take him to an ENT doctor. And he said we could do surgery or not. We tested his ear. He's got a little bit of hearing loss, but it's your decision. It's not pressing right now. So I decided not to because I don't want to do any invasive procedures on kids that are just teenagers. So let's talk about that because I bet that happens a lot with kids that have had tubes in their ears.
Well, it's an uncommon thing to happen with tubes in the ears. You know, every medical decision you make, there are pluses and minuses, and you really should have that open communication with your doctor to say, you know, what happens if we don't do anything, or what happens if we do this, because every procedure has some potential complications. You know, years ago, before I was in medicine, children who got ear infections would have serious complications from those ear infections, lifelong problems, ruptures of the eardrum that would never repair, ear infections that went on to, spread to other areas of the body, including to things like meningitis or, some terrible side effects. And we don't see that very much anymore. Mm-hmm. And we don't see that very much anymore because we use antibiotics and we have ear tubes and we catch this early. So yes, putting ear tubes in can cause some trouble. And one of the things that can happen is 1 or 2% of the time you can be left with a little hole in your eardrum where the ear tube was.
And that's the case.
And that may have happened with your son. So, there are ups and downs to every treatment.
And that's exactly what it is. He's got a little hole in his ear.
Right.
And we're choosing to leave it for now because he hasn't had another ear infection since I took him. But what do you think about that?
Well, anyone that has a hole in their eardrum, that if it's not doing anything bad, if it's not draining or smelling, and if it's not affecting your hearing, and somebody looks at it from time to time and says, hey, nothing bad is happening with this, it's okay to watch it. Okay. The only caveat to that is you can't get water in your ear.
Mm-hmm.
And that can be a hard thing for a boy, a hard thing for a teenage boy, and sometimes a hard thing for an adult as well.
That's true, and that's what caused it, because we have a pool, and I think he got swimmer's ear or water in his ear or what have you. Okay, so what else did you want to talk about? What else do you do as a otologist? What are some other surgical procedures?
Well, I do lots of surgery for the ear, and I operate 2 days a week, and that's a lot of what I do. Other things that I do are done in the office. So the ear is responsible not just for hearing, but also for balance.
Oh, I wanted to talk about that. I actually wrote that down.
Good.
Because there's a few of us at work that you notice going up and down the stairs that you're you're just not feeling, and I don't know if it's just middle age. We throw everything off as a reasonable reason not to worry about it.
Right.
So let's talk about that. If you are having some balance issues, that's scary.
Right, and the balance system is very complicated. Your balance comes from what you see with your eyes and what you feel with your ears and what you feel with your joints and how the brain integrates all that information. So if someone has a problem with dizziness or with vertigo means that you're spinning, the sense of spinning, seeing an ear doctor is part of that evaluation. But sometimes I'm one step in the whole process of finding where the dizziness comes from. Dizziness that comes from the ear, I think about it sort of there are three things that are more common and that I treat. One is called benign paroxysmal positional vertigo, and that's a mouthful. We call it BPPV for short. And with that, someone will notice a sense of spinning after they tip their head back or roll over in bed. And the spinning lasts for just about 10 seconds, maybe 15 seconds, but it's really bad and it's unnerving. And someone who has this happen to them for the first time can be absolutely distressed by how terrible this feels. They come and see me, and in the office, I can do some maneuvers where I tilt their head into certain positions and readjust the inner ear crystals. There are little calcium crystals in the inner ear, and they can leave being better.
Wow.
So that's a wonderful thing.
And do they just chalk that up and call it vertigo? Because all of a sudden, there's like 3 people I know. They're like, oh, I suffered from vertigo yesterday or last week, or I'm thinking, wow, I didn't know too many people that had that. And now all of a sudden, a lot of folks I know have that. Or is it a middle-age thing?
It's not a middle-age thing. It can happen at any age. But vertigo is a sense of movement where there is none. So if you feel like the room is spinning, or if you feel like you're spinning internally, that is the definition of vertigo. And vertigo is a symptom. It's not a diagnosis. There are many things that can cause vertigo. Migraine headaches can cause vertigo. Having bad vision in one eye can cause a sense of vertigo. And ear problems can cause vertigo. So if you're having vertigo, come in. We'll check it out.
Okay. So you hit upon the balance situation. I would say if you're having any balance issues, that's pretty important, because it could be a slew of nothing or very serious things.
That's right.
You shouldn't have a problem with your balance.
Right. I mean, there is something called the multifactorial imbalance of aging. And that,
lovely.
Yeah, right. And that just says that as we all get older, our balance organs work a little less well, our vision is a little less good, our joints are a little less sensitive, and overall there can be some deconditioning or weakness, where you see older adults moving around a little slower, taking a little time to get up from a chair instead of just going from in the bed to bouncing up and out the door. And that's really different than a new symptom, something that comes on where I feel a sense of spinning, or I can no longer keep my balance. Anything new deserves a workup.
Okay. And then we talked a little bit about chronic ear infections and the results of that. What can someone do who gets ear infections just to prevent? Is there, I don't know if there's you clean your teeth, you brush your teeth. Is there anything someone can do to prevent ear infections?
Well, that's a great question. Most ear infections come from germs that we're exposed to in our environment. Usually, touching something with your hands, you touch your nose or your mouth, and you get an infection in your nose or mouth, and it sends up into the ear. So good hand hygiene is really important. And that's to help with the middle ear infection, sort of the infection underneath of the eardrum. You can also get infections in the outer ear canal. And in the patients that I see, the number one reason for infections in the outer ear canal is using Q-tips. Q-tips to remove wax causes a couple of problems. One, it can push the wax in even further, and two, it can damage the really delicate skin that's inside of the ear canal, creating microscopic tears that allow germs to get in. Earwax is a wonderful, healthy, natural substance. It's naturally acidic, so it acts like an antibiotic in your ear, and it also waterproofs your ear canal. So if I like to joke with my patients, I say, if they stopped selling Q-tips, I'd be out of a job.
Okay, so folks, don't use My mother used to say that. Don't stick anything in your ear but your elbow. And we'd always say, what, Mom? She was a nurse. She must have learned that in nursing school. So I'm not a fan of using Q-tips. But so folks, there's one thing that we can do to help you in your daily living, and that is steer clear of the Q-tips. Now, but you hear about the wax buildup and how that's not good. So what can you do, and why does that build up? And is there anything else that you can do to prevent it from being too much wax buildup?
Right. The ear only makes wax at the very outer edge of the ear canal. So most of the time, for most people, if you don't push it in deeper with a Q-tip, it'll fall out by itself. Okay. Anything that you can see on the outside, you can wipe with a tissue and clean up, so you don't have that the ugliness of the earwax, but it should stay in there. There are some people whose earwax is either so dry, so hard, or so copious that they can't allow it to fall out on their own. I really like using over-the-counter ear wash preparations, like D-Brox is one brand name, for example, once a month, just to prevent the earwax buildup.
Okay, great. We talked during the break a little bit about dementia and hearing loss, and whether or not, if we can identify that a patient with dementia is having hearing loss, if correcting the hearing loss can help keep the further deterioration with the dementia at bay. Can we talk a little bit more about that?
Sure. There's been a lot of really wonderful work over the past couple of years about hearing loss and dementia. In this really fantastic study, 3,000 older adults were checked for dementia and for hearing loss and then followed over a long period of time. And those adults that had hearing loss were more likely to develop dementia and worse dementia than those adults that didn't have hearing loss. What we don't know yet, and the study is ongoing, is whether or not correcting the hearing loss reverses or prevents the dementia.
Wow, that would be amazing.
And there are a couple of thoughts
that's
about...
exciting.
Yeah.
To think about hearing. We hear about different molecules that, and I'm not a physician, but that aren't present in the body, and the lack of that, and how it ties to maybe children who are autistic. And we don't really know what causes it. But if it's something, and it's not simple, but if it's something like hearing that can be fixed, what a change for the 1 in 8 people that suffer from dementia. And that's getting worse. It's going to be half in the next 20 years, because I've had some folks on talking about dementia from the Alzheimer's Association. So this has got to be very big news in the industry.
That's right. And nobody is saying that hearing loss causes dementia, but could hearing loss and dementia have a common pathway where one thing causes both? Or there's another theory about cognitive load. And cognitive load means that you are working so hard to listen, that you are using so much of your brain activity to listen that you can't use it for other things. Hearing loss can also cause social isolation, which can contribute to dementia. And it could be that lack of input of sound going into the brain causes the brain actually to weaken or to atrophy. So there are a number of theories about why that happens.
That's very interesting. I look forward to hearing more about that, because what a disease that is, and what a long journey that is, and how difficult it is for caregivers as well as the patient suffering from dementia. So any movement and improvement we can make in the lives of people suffering from dementia or their caregivers is exciting, very exciting news. So any positivity and hope out there. So are there trials going on right now? Or?
Absolutely. There's a long-term study going on, and the results are not going to be out for another 6 years because it is a long-term study, taking some patients and giving them hearing aids, and taking other patients and just letting them do what they normally would have done, and see if there's a difference in the amount of dementia at the end of a long period of time. But we'll have to wait a few years for the results of that.
And you may or may not know this, but is checking the hearing a typical procedure for a physician that's treating a patient who's been recently diagnosed or is diagnosed, no matter where they are in the disease process with dementia?
Recently, Medicare came out with some recommendations for the physicians who treat Medicare patients. And one of those is that the hearing should be screened when they first enter the Medicare program, which is usually at the age of 65, and then as needed after that. So yes, I think physicians are aware of hearing loss and the impact that it can have. But as family members or who may see someone suffering with their hearing, and that maybe that person's not completely ready to accept that yet, maybe talking to them about it or bringing them in for a hearing test may make sense.
And even, too, I worry about them pulling out a hearing aid, so maybe that's where your implanted hearing aid might be beneficial, no?
Well, there are some lovely new hearing aid products. One of them is called a Lyric, and what I like about a Lyric for my older adults or my nursing home patients is that the Lyric hearing aid is put in by the audiologist, and it stays in. It's deep inside the ear. You don't see it from the outside. They wear it all day, all night, while they shower, while they swim, and just come in every 2 months and have it changed out. So there's no maintenance for the family, no maintenance for the patient. And it's wonderful for those people who have arthritis in their fingers, or even somebody who just doesn't want anybody else to know they're wearing a hearing aid.
That's great, because you worry, they have these wonderful bracelets, and if someone were to wander, but they pull them off. They don't want to wear them. So to know that there is a device that they can put in that isn't going to bother them, that they don't take out, that can be very helpful too. Okay, so before we go, because again, we just never have enough time, what are the top 3 things you want people to know before you leave here today?
Well, I want to talk for just 1 second about communicating with people who are deaf or hard of hearing. And a lot of what I do is like marriage counseling. And if I can tell the people who are around loved ones who have hearing loss just one thing: if they can see your eyes, they can hear you. And that implies not just proximity, but also attention. So tell somebody, say their name, Mom, Dad, honey, whatever you want. Get their eye contact and then start. Your communication is going to be so much better. And then if you have a hearing problem, please come get it checked out. I'm here, I'm available. Hearing loss, tinnitus, dizziness, ear infections.
I'm in trouble.
I'm here.
I'm in trouble. But I love what you said about if they can see your eyes, they can hear you. Hearing loss or not hearing loss, that's great advice for anybody. Be attentive, be in the moment, and it just helps the communication. But if someone is hard of hearing, what a blessing you just gave them by looking straight at them so that they can truly understand what you're trying to communicate to them, because it's frustrating.
Absolutely. On both ends.
Yes.
Yeah.
Well, thank you so much for being here, Dr. Tirino. Again, you can reach her at 770-225, and I not only have hearing loss, but sight loss, 770-225-1874. Thanks for joining me again this week. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead, and listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.